All right, so now I'm joined by Kristin Wilton, and she actually worked in the Communications and Public Relations Department at the IWK Foundation, one of the primary partners of the IWK Health Centre. So I'm just going to ask Kristin a few questions and get a nice description of her experience when she worked at the foundation. So thank you for joining me.
Thank you for having me.
The first question I'm going to ask Kristin is to describe some of the work initiatives done by the foundation.
Okay, so as you all may know, the IWK Foundation is the fundraising arm of the IWK Health Centre. So some initiatives that we would look after, basically everything that has to do with donors and raising the most money for the most urgent priorities of the patients. So that would range from events like radiothons, which they would have 3 times a year, one at the IWK Health Centre, one in PEI and in Moncton, since they look after patients right across the Maritimes. And for radiothons, they would raise anywhere from $50,000 to $500,000. And also another big fundraiser is the IWK Telethon for Children, which is the Foundation's largest annual fundraiser. And now that is raising over $6 million, almost $7 million now. And that the planning for that, the second that the first fundraiser is, or the first telethon is over, the next day they're planning for the next year. So it goes all year round for this 2-day fundraiser. So that brings all the donors together, and it's really the most rewarding event of the foundation. And other initiatives would be accountability pieces. So you're pretty much putting on paper or in promotional materials what the donors' funds are going towards. So anywhere from patient monitors in the emergency department to funding a research study to find a treatment for leukemia in children. And also we work very closely with our donors in the events they do that we don't really play a part in. So for example, Dairy Queen's Miracle Treat Day, where 100% of the proceeds from blizzards would go to the IWK Foundation, or Walmart Walk for Miracles, where customers would come up and they would donate $1 as they're paying for their items, and they would write their name on a balloon, and then they would have one big donation at the end of the year.
Great. And how does the work that you just described at the foundation transition to the work done at the IWK Health Centre?
Well, every single event that the IWK Foundation does, it couldn't be done without the help of the IWK Health Centre. It all goes hand in hand. While they might not look after any fundraising initiatives, they do a lot of the background work. So if I'm writing an accountability piece, we always incorporate a patient into the accountability piece, just so the donors can know what they really need and what their funds are doing for the patients itself. So say I would need to write a patient profile story, so I would need to contact an IWK child life worker. I would also have to contact someone from the PR team, because when I go to interview this patient and their family, I can't do it without them being in the room. So it all just goes hand in hand. We just need to have that straight line of contact, which is always there. They've always worked very well together, and even with all of our events, like the telethon and radiothons, they happen right in the health center itself. So we couldn't do it without the help of them and their volunteer work and all of that coming together.
Great. And can you name a particular event that you took place in that stood out in your experience?
So I'd have to say the most significant event would be the IWK Telethon for Children. So I played a part in the planning of 2 telethons. It takes, like I said, a full year to plan for one telethon. So what I took part in for this particular telethon, I worked with CTV cameras, and we would do a couple minutes of live interviews with a patient and their family in their room between segments. So of course I would have to work with the IWK and all the doctors, and we would rush up between segments and interview this patient in their room, and it's just live on camera. For example, we went up to the maternity ward, and this is literally a couple hours after this patient had her baby. So, and she's holding her newborn baby, and it's right in the moment. So it's a really meaningful event, but to see it all come over 2 days and everybody come together and to announce the final total being over $6 million at the end of the 2 days, it's just one of the most rewarding things ever. Bring tears to your eyes. But yeah, I think that is the most significant event that I took part in.
Well, thank you so much, Kristin, for joining me. I also want to thank Dr. Scott for allowing me to take part in this type of research paper about the IWK Health Centre. It tremendously opened my eyes to the work not only done at the foundation where Kristin worked, but also all those proceeds and the work that they do there to go towards the health center and helping the women, children, families, and the patients across the maritime provinces. So thank you so much, Dr. Scott, for allowing me to do that. And I hope you enjoy not only my paper, but my presentation as well as the video just conducted today. So thank you.